If there's one thing in dentistry that most dentists are confused about or fearful of, it's occlusion. The problem is a lot of patients in their practice have problems with their occlusion, and a lot of patients in their practice need significantly more dentistry than 2 teeth. Well, if you're afraid of occlusion and your patient needs 12 upper restorations, the safe way to do it will be to do 2, finish them, do 2 more, finish them, do 2 more, finish them. An incredibly inefficient approach, and it also won't give you the best result aesthetically or honestly functionally either. The ideal approach would be do the 12, but that means you're going to change the patient's bite, and that creates a lot of anxiety for most dentists. So what demystifying occlusion is about is it's really about helping a dentist to, number one, understand concepts of occlusion, which is frankly why there's so much confusion. Is occlusion has traditionally been taught in some very dogmatic belief systems, much like religion. And so those who believed a certain occlusal philosophy believed everybody else's was wrong. You had to practice it this way. So that particular seminar, we start by talking about all of the philosophies and the fact that most of the time they all work. Now that's a problem if you believe one of the philosophies. It's awesome if you don't, because what it says is where they differ probably isn't important. If most of them work most of the time, then the differences between them aren't the big issue. It's what they're doing similarly that's probably the big issue. Now, when are the differences important? Because there are some times that what we do doesn't work for a patient, so we need to learn those things. But we don't teach an occlusal philosophy. What we do is we teach how to evaluate the patient, how to evaluate the patient's jaw joints, muscles, and teeth, and let those dictate what we need to do with the patient's occlusion. I would describe it as a course that demystifies occlusion. It tries to take the dogma out of it completely and say, forget the philosophies. The philosophies are irrelevant. How could you believe one philosophy is right when the other one works too? That would be crazy. And so let's focus on the patient and what it is about the patients that makes them work, what elements of those philosophies work together in that patient, and if this different patient comes along, what do we need to do when we find them? So essentially that's the seminar.